On this episode of the Big Insurance Connect, I had a real conversation with Austin about how you can use AFLAC to cover up the gaps in your health insurance, especially if you're a small business. You cannot afford to miss this. Let's check it out. Hey y'all, it's Moon Thomas, your social media insurance advisor, and I'm here with the man, Austin. Austin, I've been waiting a long time to do this interview, and
Let's go.
You guys, I'm excited to introduce to you Austin. He is my community business partner for AFLAC. Look.
Oh, you're ready. You're ready.
Yes. Oh gosh. You know what? This is such a full circle moment. You know, I've shared this story a million times. Like AFLAC literally was my first sales job when I first got out in the field and everything. And
Okay.
I mean, I just believe that AFLAC does owe me and my husband a vow renewal because that's how I exactly met him, selling AFLAC.
And you met him selling AFLAC?
Yes.
I didn't know that.
I did. So actually, one of my clients was a barbershop, and it happened to be the barbershop that my husband's friend was managing at the time. And I go in there like in December of 2010, and
Okay.
I'm end of the year, open enrollment time. Hey, you got anything you want to add, change, do anything? No. So he says in front of everybody, his friend, well, why don't you send your boyfriend in here to get a haircut? And I was like, I don't have a boyfriend. And he's like, good, because I have somebody I want you to meet. And that's how it started.
So you said I got somebody you want to meet and it's me, or did you have somebody to set you up with?
No, it was his friend, which happens to be my husband, and we went on a date, and that was in 2010, and we got married in 2013, and we're still still rolling.
That's fantastic. So his buddy worked at the barbershop.
Yes.
That's awesome.
Here, and this is what I think. I feel like AFLAC could sponsor I'll wait and give him to my 15-year wedding anniversary, give him a little bit of time to get their money up.
Renew the vows.
Renew the vows, that kind of stuff.
That's awesome. I love it. Okay.
I can see it now. Ducks everywhere, blue, white, and yellow is the colors.
We got ducks everywhere.
Exactly.
I mean, I'm covered up in ducks, so we got plenty of them.
Tell me about the ducks, though. Somebody was, I think it might have been John that was kind of explaining about the ducks in terms of donations. Is that true?
Yeah. So a couple things. So the duck hit the market in 2000. And before that, AFLAC was actually it's an acronym. It's American Family Life Assurance Company. And so the duck hit the market in 2000, and that's when really the company, I would say, exploded. I mean, everybody knew the duck. They understood the duck. They started seeing the commercials. The branding came out, and it just went wild. And actually, it's funny. This one I'm holding. This is randomly on my desk. We weren't even prepping for this, but this is one of the old school ones. It's from 2013.
Oh wow!
And so it's through Macy's, and so we had a partnership with Macy's, and we raised a ton of money. And all this, a lot of our money we're doing as a company, a lot of it goes back to Children's Healthcare Atlanta. And so we actually have a wing down in Atlanta where the entire focus is kids who are battling pediatric cancer. And we've since expanded this relationship. And so we actually now have, it's called the My Special AFLAC Duck, which is actually a robotic duck that the kids there will use to communicate with their doctors and nurses.
Really?
Yeah. So it's in the cancer center. So basically imagine, obviously it's a terrible time, and obviously with you having kids that are very sick, but they're truly using this duck as they're going through treatment. They're actually kind of treating their duck. It's got like little emojis. They press it on the chest, and the duck mimics, reacts, and so they're really using that duck to help communicate, with their doctors and nurses right there internally, it's awesome. I mean, it's super cool, and it's right here in our backyard. So I always love talking about our partnership with CHOA, but it's and you'll never see a commercial for it either. That's completely behind the scenes. It's cool.
I never knew that, and that part about the duck communicating and things, that's even deeper than what I knew about the contributions. But I'm so glad that is a charity and a cause that you guys get behind and you support, and that is amazing. So I know AFLAC is a household name. most people are, maybe familiar with it through their jobs. But the reason why I wanted you to come on today and really speak to this is because, we just try to be a resource. And, I, primarily am in the Medicare space. However, I also do under 65 for ACA. Yep. And there are a lot of independent insurance agents, a lot of entrepreneurs, a lot of self-employed people that I run across. And that's why I feel like this partnership for us is full circle, because not only can I help individuals, but then I partner with you for the groups. And that's something I kind of wanted to touch on today, because the gaps that are in the healthcare, and I'm looking at the high deductibles and, the copays and the out-of-pocket costs that are quote unquote unexpected. And, how do you utilize AFLAC in a situation like that, based on your experience?
Yeah, that's a great question. It's really, I say it quite a lot with my team and the people who interact with the community, but, AFLAC obviously has changed. It's evolved over the years. But to our core, it's pretty similar, right? It helps cover the gaps, right? You talk about, but really the fact is that everything around us has just changed exponentially, right? Our health insurance is not what it used to be, right? That gap we're referring to, like our co-pays or deductible, like, okay, in the last couple of years, has your health insurance gone up or down in cost?
Up, obviously.
Up, right? Big time. What about the co-pays and deductibles? Up, big time, right? Like the gap that we're talking about, like it's very real. And I think, like, so for me, you mentioned 2010. So I got started in this business back in 2012. And, back then, we had $1,000 or maybe $2,000 deductibles. And, if somebody got hurt and they broke their arm or severely sick, like, yeah, it sucked. But I wasn't worried about losing my house.
Right.
And now, I mean, it's nothing to see a $15,000, $20,000, $30,000 max out of pocket on a health insurance plan, which is insane. And then you look at somebody go out of network. You're like, is this even insurance? Like, people don't have $5,000, let alone $30,000 laying around just in case. So it's becoming more and more necessary. And that honestly really ties in this. I have a great visual I can show you all. This is where I tell everybody, like, the reality is, again, we'll get back to that gap in a second. But I think what's more important to understand is, like, okay, who do we pay? Right. And this is where I think people have to realize quickly, if you take away anything from this call here today, is like, we're not health insurance. We're not. Like, you have if you're on Medicare, Medicaid, Blue Cross, Blue Shield, Kaiser, all of those carriers, all those companies, they pay the doctors, they pay the pharmacy, they pay them, right? Mm-hmm. AFLAC actually pays the human, pays the employee, right? So check this out. I'll show you this. This is always a good visual I use for a lot of anytime we do presentations or conversation, to get a good grasp on what AFLAC is. And if you can see this, I'll show you guys kind of an easy walk you through. And this is where, like, Moon, if I use you as an example, right? If you're out there, living your life's plan, right? And all of a sudden, life throws us a curveball. Maybe we're hurt or we're sick or we're out of work, right? Listen, life happens, and maybe we're just having a baby, right? Nothing terrible, something exciting, like having a baby. Like, life happens. But inevitably, when life does happen, typically we find ourselves in a situation where, if I'm hurt, I'm sick, I'm out of work, well, my income's going to slow down. And if our income slows down, Moon, do our bills at home stop coming in?
Absolutely not.
No, they don't. They don't. And I bet either you or some of the people here today listening today can relate to a time when there was a little bit of a gap, right? Life happened, income slowed down, the bills didn't stop. Well, it's super corny, so I know, so bear with me, but when we call that gap, get AFLAC protection.
I love that. Oh my gosh. I mean,
that's what we do, right? But here's the
easy way to think about it.
Yes. But here's the kicker. And this is where I was going back to the beginning where I said who we pay. This is the most important part of AFLAC. Mm-hmm. Is when I say we step in, we say, hey, here's money, go home, pay the bills. We do not pay the doctors, the pharmacies, the physicians. We pay Moon. We pay you, the employee.
Right.
And why I think that's so important is if I'm in a bad spot, right? Life happens, I'm out of work, income stop, bills are stacking. And all of a sudden I'm stuck with a big doctor bill. But the rent or mortgage is due.
Yeah.
And we can only pay one. Which one do we pay? A doctor bill or the mortgage or the rent?
Of course, you're going to keep a roof over your head.
Why?
Because you need that until you can get better, so you can get back to work.
Amen. Right? We have somewhere to live.
Mm-hmm.
Listen, the doctors, they're good. They're going to get their money. For us, like, we have somewhere to live. And that's what AFLAC here for, is like whatever life throws at us. If you're hurt, you're sick, you got to work, here's money, go home, pay the bills. Now, we offer a bunch of different products and services today on this call. I don't want to spend much time diving into, but just know that they're all here to be fully customized for the need of the individual. Like, what do they need, right? So, like, for example, like over here on the left, like accident and hospital. Like, if you have kids or anybody here has kids that are active, like in general, like, kids are nuts. They're always getting hurt. They're always getting sick. And if I'm in the hospital is not an affordable vacation stay.
Right.
Flip it over to the far right, dental and vision. We've become one of the fastest growing dental and vision providers in the country. We have an incredible dental plan that where you go to any dentist, anywhere, anytime with no restrictions and no waiting periods, which is very unique.
Very.
Disability life, we're talking COVID or maternity leave, or you ever seen a GoFundMe before?
All the time.
Right? People need money. Right? I wonder why we're so busy right now.
Yeah.
What about this one? I'm just curious. I don't have a raised point about it. What about this one? You ever know anybody that's been impacted by cancer?
Yeah, I mean, that's even part of my own personal, impact story when it comes to AFLAC. Really close family member of mine had cancer, went through surgery, of course, thank God in remission and all of those things. However, had AFLAC through his job and probably was paying on it and didn't even realize that he had it, just elected it, Yeah. And then look, as soon as he was out of work, recovering, he got, checks for the surgery, for the treatment, for the recovery time, all the follow-up appointments. He basically had to put in the claims. And I know now that was years ago, but now the claims process is even faster.
Yeah.
So it was money come back into the household during that time period.
And when you think about something like cancer, like it's such a great example of really why I think we're so relevant right now. And again, I think about the bills at home. Like, I don't know about you, but like my bills haven't gotten smaller. Right?
Okay.
Like they keep going up every year, right? And then you think about trying to battle cancer in the midst of that, and then they start stacking. Like, it's just really hard to focus on getting better.
Right.
And less and less of the bills coming in. That's why we're here. It's like, listen, like whatever life throws at us. If we're hurt, I'm sick, I'm out of work, I've got kids, like, okay, cool, I get it. You got bills. We're gonna help cover that gap. And I think again, just because of the impacts and the changes over the years of our health insurance, like that's why we've become so busy lately. And that's why I try to then shift, obviously, the understanding from an employee perspective. A lot of people today nowadays, I think, can really grasp and understand, like, okay, like, yeah, I get it. Like, there is a need for it. But then trying to then tie that back into the business. And that's where now I spend the bulk of my time in my career now, as I interact with a lot of the, as you mentioned before, groups, small family-owned businesses. I mean, we work with, anybody, from a small family-owned barbershop, right? Where your buddy, your husband's buddy worked at, all the way up to, the city of Atlanta, Fulton County, Clayton County, some of the massive, Delta Airlines, a couple of clients here locally. Like, we've got massive corporations we work with. And whether it's a giant corporation or small family-owned business, their people need help. And I think at the end of the day is not only being able to provide the help is obviously key, but then these small and mid-sized companies are realizing quickly that they have to do more and more to stay competitive in the marketplace they're in right now today, right? Like, for example, like take a restaurant, right? Mm-hmm. When was the last time you were inside of a restaurant and saw a "we're hiring" sign?
All the time.
They're everywhere.
Yeah.
Everybody's hiring, right? Finding and keeping employees today is hands down one of the top priorities of small family and business today in America, right?
Yeah.
Finding and keeping. And then when we meet with these companies, right, we understand what's going on and we try to diagnose some of the ins and outs of their business and how we may or may not be able to help. One of the questions I ask constantly is, okay, great, I love it, right? You're a growing business. You've got a hiring sign up. You've got 15, 20 employees, whatever the situation is. And one of my questions is, okay, well, cool. Other than a paycheck, what benefits do you provide to your people?
Yeah. And most of them are none.
Exactly right. And that's what's so crazy. How many of these companies today say, well, no, we don't do that, right? Oh no, we're a restaurant, we're a daycare. We can't afford benefits.
Right.
And that's what's so great about AFLAC, and a lot of people don't know, is that for a company today, like no catch, no string, that cool. You can actually offer benefits to the employees. The employees here today can cover themselves, their spouse, their kids, whatever their situation is. And there's absolutely zero cost to the business, zero cost to the company. They can make it available. We customize the options and let the people take advantage of it. And they're getting great products at a group rate that they can keep forever.
Right. And those groups only have to be a minimum of 3. Is that correct?
Yeah, tiny, right? Small 3-person company, right? So, and not to say that we can't work with individuals, as you mentioned before, we do, but these companies with 3, 4, 5 employees, they're getting group rates, so they're substantially more affordable than individual rates. They're locked in. And what's cool, lastly, is our rates never change.
I love that.
It's very unique in this business, right? A lot of times with insurance products out there, and this is where, I love the insurance world. I've been doing it forever now, but a lot of times, like, for example, like with car insurance, we have a product and we hope we never need it or hope we never use it.
Right.
With AFLAC, use it. Take advantage of it, because not only the rates aren't going to change, they're locked in, but we're going to pay you cash.
So what do you think are like the most, sought after plans, mostly like accident plans or just the hospital indemnity plans?
It's funny because I really think, if we look at some of our key products in general, right? Like, for example, like our dental and vision, we've become one of the fastest growing and most requested products out there. From there, though, of course, accident all day long. If I get hurt, right? I always share, like I broke my hand a couple years back. I ruptured my Achilles when I was 30. It's brutal, right? I get hurt. I go to the hospital. AFLAC pays cash, helps cover the bills.
Yeah.
But really, as a company, our focus has really been on cancer as of lately, and it is as far as we call it in our world, kind of from a loss ratio perspective. Yeah. It pays out the most, so it brings the most value to our clients. And we're not talking, 10 or 15 or 30, we're talking, $20,000, $30,000 payouts.
Right.
It's like massive, massive payouts. And so I would say between some of our core, it's, hey, if I'm hurt, right, I want to go to the hospital, the doctor, my kids are playing sports, accident, disability all day long. If I'm older, you're talking about heart disease, cancer, strokes, all those majors. Like, listen, if I break my arm, yeah, it sucks. If I have a heart attack or stroke and I'm out for 2 months,
right?
How many people can afford to sit at home for 2 months without a paycheck?
It's a game changer. Literally, it is. Yeah. I mean, I just love the fact that it's available. It's accessible. You don't have to be a huge corporation just to take advantage of it. Yeah. And then, just if you are, just happen to be like a, single member LLC, it is an individual, we can still help. So there's really no one that has to go uncovered, between, what you and your team do and what, I'm able to do to help to fill in the gaps. AFLAC is definitely hands down household name. It's definitely reputable, and it's a proven system. So I just love the fact that I don't try to sell anything. I like to inform people about what their options are, and I personally know that this product does work. I've seen it work, from my own experience and from just people that I have that are close to me that have had situations where they needed to utilize it. Yeah. It is one of those things that when you think about, do I need this or do I don't need it? You really need to consider it, especially for the cost. It could be minimal compared to what it would cost you if you didn't have it.
Yeah. And what's wild too, and I guess I'd maybe leave it this too, to kind of maybe if somebody today doesn't know, hardly anything about AFLAC at all, I would say that starters too, it is here in Georgia, right? So I know we're all both here in Georgia, started here in Georgia back in the 50s. We've been doing this the longest on all the other carriers out there as far as what we do. Mm-hmm. And for the last 18 years straight, we've been voted America's top 10 most ethical companies. Now, call it what you want, y'all, but insurance and ethics?
Yeah, I know.
They just don't always go hand, they just don't. And the fact on that list, it just makes our lives a whole heck of a lot easier from an AFLAC, being here perspective, because when I say AFLAC cares and they're standing behind the word, like they do it. And if they didn't, like it'd be so hard to do this job, but they do. And I think they really do care and they want to help. And you talk about claims, like our claims are so easy, right? You can, I got, my daughter, I got a toddler, I got an 18-month-old. She was sick. We were down in Choa. She had a high fever. We went in, got the hospital bills, got the doctor bills, spent the overnight stay. You leave, you get a discharge report. You take a picture of it, you upload it, and right now, like 80% of our claims are paid out in less than 4 days. Direct deposit, here you go. Like, so no faxing, none of that. No, it's easy. You log in, you're done.
Yeah, that's amazing.
And that's all people want. They just want to get cash. Like, I need help. Like, my bills are stacking. Like, can you help me? I'm like, yeah, we can.
Yeah. That's a big deal. And the reason why I'm saying that is because even if, some people are utilizing other types of indemnity policies, that the claims process is so cumbersome, or it just takes so much that sometimes, people forego even putting in the claim, or there's a reason that's always found for why it should be denied. So I think that this is amazing. I'm so glad that I reconnected with AFLAC. I'm glad to have it part of my portfolio. Yep. And, I stand by the product. So I love you for being with us today, Austin. Y'all, listen, if you don't know, you got to look into AFLAC. It is one of the best products out on the market. And I'm going to always be, a resource. I would not be, promoting anything that I personally did not trust or use. And also, I really wouldn't be, quote unquote, selling anything that I know didn't work. So I literally stand behind the product. And it's really one of the main reasons why I'm in the insurance industry right now. So can you work on getting my vow renewal?
Let's go. I got you. We'll set it up. I got all the ducks.
Look, it can definitely be. It can really be right at the corporate office.
We'll tell Dan, get ready. We're coming down.
Exactly. All right. Well, I appreciate you so much for being with us today, Austin. You guys, until the next time, I love you and I mean it.
Appreciate it. Thanks for having me. Love it.
You're welcome.
If you enjoyed this episode, do me a big favor. Please like, share, and subscribe to the #1 insurance resource that has you covered from the womb to the tomb for all things health and wealth. Until the next time, I love you and I mean it.